W12 Together started off as a resident-led board. We thought, how can we make decisions for the whole community? So we did a lot of research, asking and canvassing people in the community to see what they wanted. And they really wanted us to focus on young people in the area. They wanted us to focus on their health and well-being, and also to focus on coming together.
I think W12 Together has really shown the power of community and the power of community-led responses to a range of issues, all the way from the COVID pandemic when local families were struggling, all the way through the cost of living crisis. More recently, we've been doing a whole load of events.
I'm a committee member on W12 Together. I lead on youth activities. Growing up in this area, obviously was a good place to grow up in, but you also saw all the different needs across the variety of different people and demographics.
I'm Harry Jones. I was the original chair. There had been a big local before in the area that had sort of slightly fallen apart due to sort of different groups not really getting on with each other. We wanted to show that it definitely was possible. When you're unified, you've got a sort of stronger voice, haven't you?
We have a festival that we run every year. We've also been able to work on culturally appropriate health initiatives in the area, things like mental health and well-being, and thinking about mental health on a spectrum. So we very much focus on well-being services, so things that could support the NHS.
I think you could see a lot of different needs that, especially in my community, like there's a big Somali community in White City, and there's a variety of different needs. A lot of the people are not fluent English speakers, so the mums, when they're taking their kids to, like, for example, the GP and stuff, they can't get those needs. Autism's quite big in the community as well.
I think we saw that there are some massive health inequalities in this borough, and we saw that existing approaches weren't working.
We are becoming a charity, which we're very excited about, and we are hoping to expand, moving into exclusive sort of health and well-being. How can we work with the NHS in order to be able to support them?
W12 Together has a really strong understanding of why existing health and care services are often insufficient and why local people might not be accessing those services. As a result of understanding those reasons, we can design health and care support offers that are really tailored to the community and tailored to their needs.
We have a plan and a programme, so behind us is Parkview, and our hope is to have a community classroom behind us in the GP surgery. And the idea is, for example, if someone is diagnosed with diabetes and they have a 15-minute, 10-minute consultation with their GP, they might be confused, there might be loads more questions. What we would offer then is information about diabetes, thinking also about culturally, what are the cultural foods that they're eating, how can those be adapted so they still eat the foods that are important to them, but in a way that's helpful for their health. Also thinking about people who may be experts by experience in the community. While medical intervention is essential, we also think that community element as well, and feeling that actually we're doing it together and you're being supported in your community.
Look into the future, we're going to obviously change it from what we were previously into a charity, but I think our values are still the same.
W12 Together believes that money can be spent much more efficiently, especially in health and social care, if the community is consulted before services are commissioned and not afterwards, and also including the voluntary sector from the very beginning.
You get people from the community that know what the actual community needs, and then you feed in and you build on those projects and you deliver to that same community that you're living in.
We are now working with lots of other local partners to try and help bring bigger and better things together for the future, helping be that bridge between the NHS and community.
What W12 Together apart, it's community driven, it's from the ground up, and we've done this before. We've been doing it for a number of years now, managed over £1 million actually.
Currently, we don't think there is anyone that's doing exactly what we do. The cross-cultural work that we do, I think, is really essential for this area because there are a lot of organisations that work with specific communities. We can be much more efficient if we're engaging people in the community with the planning of services, with the engagement of services, and we're thinking about the voluntary sector while we're planning services, not as an afterthought.